on the visit?
Yes, that is my son there in his office at work, Jim Musgrave.
Hello.
And that is his wife, my daughter-in-law, Sandy, at her home office.
Yep.
Good. Okay. Well, Jim and Sandy, nice to meet you as well.
Nice to meet you.
So, you were last seen by Dr. Johnson a little bit ago. It looks like in June. And so I just want to get some updates first, if that's okay.
Sure.
Are you still on pembrolizumab?
What is that?
What's that? Yeah.
Keytruda. Are you still on Keytruda?
Yes.
Yeah.
I know there's so many different names. Okay,
I hadn't heard that one, but yes, I am. Every 3 weeks.
every 3 weeks. Do you know what cycle you're on?
Shoot.
When did you have your last appointment?
How many
Yesterday.
I
doses
just
have you
had
done?
an appointment this week. And
Yesterday.
I don't know if that's 7 or I don't know when I started, Sandy.
I could probably look it up.
That would be great.
Let's see, because you had your first one in the hospital with Dr. Johnson.
Yeah.
Yeah. I see that in June, I think it was the 4th cycle. And so, yeah.
Which one was the 4th in June?
Yeah, the 4th, it looks like 6/9.
6/9. Okay.
Was the
So
4th cycle.
then she had one on the 1st of July,
Okay.
and then, the 1st of July, and then the 22nd of July,
Okay, WC6.
and then August. Let's see.
This past one.
Yeah, just this last one.
Yeah, I
That
thought
would have been 7. Yeah.
Yeah.
No, 'cause
August when?
it would have been one in August and now this one in September, though, Sandy.
Oh yeah, you're right. Oh yeah, the 12th.
August 12th. Okay.
Yep, the 12th. You're right. So there's more than that.
And then early this month, you got one?
No, just
I
yesterday.
just got one.
Yesterday.
Yeah. So that's 8.
C8, I believe.
Yeah.
8. Yeah.
Okay. Good. Thank you for that.
Yeah.
Daniela, how are you tolerating the Keytruda? Are you experiencing any side effects?
No. I still don't have full energy back for sure. But that's the only thing that I notice lacking. I'm not having stomach issues or bowel issues or sleep issues or
Yeah, she seems to tolerate it pretty well.
That's really good. So you said the only thing is that you're not quite at full energy level, but otherwise feeling really well.
yes, I am.
Good. And you said no abdominal pain,
No,
no diarrhea or constipation.
neither. No hair loss.
Yes, the Keytruda is exactly. It's a different type of chemotherapy, so it doesn't affect the hair cells in the same way that other chemotherapy does.
Yeah.
Do you have you had any rashes on the skin?
No, I don't think so.
And any fevers or chills?
No,
Any nausea or vomiting?
no. I've gained 15 pounds.
Wow.
Well, I lost 30 or 35.
Yeah.
Yeah.
Or she's on the road to gaining back everything.
Well, that's good.
Fatty.
I know.
Lay off them donuts.
Is that through increased eating, increased appetite, exercise, or all of the above?
All of the above.
Okay. That's really good to hear.
Amen. Very, very, very pleased. I wanted to tell you that, Sandy. I'm 115 as of yesterday.
Yay.
Like
Okay.
I know it's coming back too quick here.
Yeah. No, you still need to gain a little bit more. This 120 would probably be good, you know.
Okay, I know, but will I be able to stop them? It's okay.
Are you walking unsupported?
Yes, I am.
How often do you walk?
Not as often as I need to. But I am walking every day because I'm either going to a grocery store or I've got physical therapy. I do physical therapy twice a week. But I am even looking back to getting back to yoga very quickly here, I think. Chair yoga, gentle yoga.
What is the physical therapy for?
For the hip,
For the hip. Okay.
Yeah, she
Is that-
broke her hip.
Yeah, I see that. Is that helping with the hip?
I'm sorry, is it helping? Is that what you asked me?
Yes.
Yes, it is. It's not going quite as fast, but I am progressing. There was some difficulty and pain in the groin area every time I stand up or if I've been walking for any length of time, but it definitely is improving.
All right, I'm plugging in here.
Have you been tracking? So you said the 15-pound weight gain. Has your weight been stable recently, or when was the 15-pound weight gain? Was that a while ago in the summer, or more recently as well?
Since what was the date that I left Vienna? Was that in April?
Well, it's been
Yeah,
pretty,
April.
been pretty steady.
Yeah.
Steady. Okay.
I think I was still not much over 100 pounds then. So since then, it's been increasing.
Yeah. Okay. And so, are you walking with a walker at all, or
No,
no walker? Okay.
I guess if I had to do great lengths, but I do have a walker. I just don't use it.
Have you been to the ER recently?
No, thank you.
Good.
Good.
Do you have any headaches or dizziness?
None.
Is there any blood in the stool or urine?
None.
Difficulty swallowing or painful to swallow?
None.
Any cough, shortness of breath,
None.
chest pain?
No, sometimes I feel like I can't take as deep a breath as I used to, but I think that's lack of exercise for sure. Just need to do more breathing work.
Okay, but no cough or shortness of breath.
No,
But
no,
not able to take as deep a breath as you'd like sometimes.
you're right.
Yeah.
If you were to inhale really fully, take a big breath and then breathe out, would there be any pain or wheezing?
No, there's no reason.
Okay. I see in past notes that you had some tingling or numbness in the feet. Is that still present?
No, that has really lessened up. I'm wondering if that's the gabapentin that I take at night. I take one gabapentin, it's 100 milligrams or whatever. I take that at night. It's the only thing I'm taking, actually. Other
It's the only
than I take-
medication you're on?
It is. I'm taking a lot of supplements.
What supplements are you taking?
I hope your pen has a lot of ink in it.
Sandy's got the list. I don't.
No, I don't know everything. Yeah.
I'm not at home.
I mean, they're basic things, like, but then also some vitamins. I think they had her on folic acid and D and taking melatonin to help with the sleep. What else are you taking? I think
Mistletoe.
NAC.
Mistletoe.
Yeah. Lipic acid,
Yeah.
vitamin C, powdered vitamin C.
So I
What's
guess,
the stuff that you help me order? What's that?
Yeah. A
Mistletoe.
little, and then a little like prebiotic, probiotic to kind of help with which seemed to help her when she was constipated before, and now that has seemed to help.
okay, so I have folic acid, vitamin D, vitamin C, melatonin, probiotics. What have I missed?
Probably magnesium.
Magnesium.
What about the
Yeah.
mistletoe?
Do you know how much magnesium she's taking?
Boy, I'm taking that calm and I'm doing it twice a day.
200 milligrams of magnesium.
Yeah. Twice a day, in the morning and in the evening.
What about the mistletoe?
Yeah, she, so we have a naturopath that, wanted her to try a little mistletoe for other, just for prevention. And so she has been trying that a little bit. And we want to talk to Dr. Johnson about that and see what his thoughts are on that. I know they use it in Europe as like a standard protocol to go along with it, but wanted to run that by him.
Okay.
And the LDN.
But you haven't started that. She suggested
No.
the LDN.
What is LDN?
Low dose now
Yeah, we hadn't decided if you wanted to do that for sure, or did you get it?
I do have it.
You do have it.
Now,
Low dose naltrexone.
yeah,
Yeah.
that's it.
That was another suggestion she had. I know she had requested the records from Dr. Johnson, so I don't know if he's aware that she's seeing her along with, just to try to get her body in a good place, getting her immune system back and, all that. She just was so depleted after chemo.
Right.
'Cause she's
We're just doing all we can to try to get her in a good spot.
Yeah, definitely. No, it's always better to make sure that everyone's on the same page in terms of what you're taking.
Yeah.
That is, if there's something that does need to be modified, or if you do start to experience a side effect, we're able to say, oh, okay, well, this was recently changed, or we added this, or it's definitely not that, and that's only possible when everyone knows what both sides are doing. And so, obviously, if Dr. Johnson has a specific comment or feedback on a certain supplement, I'm sure he'll be willing to say so. But otherwise, I think he'd be probably most interested in just knowing everything that you're taking.
Yeah.
I'm taking CBD and THC at night,
Okay.
1-to-1.
To help you sleep.
Yeah. Between that and the melatonin, you can get a good night's sleep.
Okay.
And the gabapentin adds to it too. That relaxes you.
Right.
Yeah. So she has kind of taken a lot, and so it is probably good to run that by him.
Definitely.
But the symptoms, everything seems to be so much better, right? I mean, she seems to be doing so good.
It's really great for us to hear how well you're doing.
Thank you.
And I also just see, I'm trying to be thorough, make sure I don't miss anything. I see in a previous note you also had some burning in the sternum after eating in the past. Is that still present or not anymore?
No.
No. Okay.
Yes, and I'm wanting to take a road trip, so I want to know that. I think I'm healthy enough to be able to take a road trip up to Oregon.
Oh, very nice. Okay.
Yeah, I'm waiting for the green lights on that one. Haven't been anywhere in a year.
Right. Right. So, are you going along the Oregon coast, or where are you going to go in Oregon?
Seaford, up on the Oregon coast, right on the ocean there.
Wow.
Yeah, it's beautiful there. I've been there before. It's with good friends that have a big motorhome, so it's really relaxing and beautiful.
Very nice. Well, yeah, I definitely hope you're able to go.
Yeah.
Amen.
Amen. Okay. Just a few more questions. Have you ever smoked tobacco?
Years ago, probably for about 5 years, in my late teens, early 20s.
Yeah, 50 years ago. 42.
Don't remind me.
Do you remember how much you used to smoke at that time? Was it 1 cigarette a day? Was it 1 pack a day?
Depends how much your kids were acting up.
Yeah, he was a hard kid, I'll tell you. About a quarter of a pack at that, or 8,
I'd be surprised. Might be undershooting that a little bit, but
Oh my gosh, were you there? You were too young to know. I quit when you were there.
And then, and so no current cigarette use or tobacco use?
No, just the CBD and THC.
Okay. And then do you drink alcohol?
No. I'd like to have a
No,
glass of wine.
we
but
don't
they won't
never.
let me have wine. They won't let me have any wine.
Oh, well, we were gonna have a glass to celebrate your good skin, though.
Yeah. Good. Okay.
Wine and ice cream. That's what I want back.
Wine and ice cream. Okay. Gotcha. And what about previous alcohol use in the past?
Not a problem.
Very, very occasional.
Once a month, a glass
Only
of
if
wine.
she came to my house for dinner, we might have a glass. But she'd have like a half a glass, not very much.
Okay. Well, I want to ask now. I asked a lot of questions. Do you guys have any specific questions for me or Dr. Johnson that you want me to write down right now?
Well, just wondering about the future, what the future looks like, and then that road trip she wants to take on is going to kick her a week late on her next Keytruda. So I want to know if, the next one might go 4 weeks if she goes on this road
Okay.
trip.
Yeah.
And then she's not vaccinated. And originally, when she was in the hospital, they told her for COVID, they told her not to do it. But now, she's working with an oncologist in Lodi here, Dr. Mehdi, and he said get it. And our naturopath said get it. But wanted to find out what Dr. Johnson thought. Because previously, it wasn't Dr. Johnson. It was when she was in the hospital at Stanford. They're the ones that said don't get it, the oncologist there.
Because it was like the day before she was going to get her first Keytruda. So
Right.
I think they thought it was good timing to mess with her immune system at that time,
Right. Right.
I did get a test back yesterday that I have that I had that antibodies.
Antibody test.
Yeah.
I wanted to see that. Do you have the paper on that?
I do have the paper on it, yeah. I meant to show it to you last night, and it's kind of funny, because the one, she went over it, the nurse there did, because she went in and talked to the doctor about it, and she said, yes, it's very definitely just what I thought, that you tested positive for the past, and there's 2 pages for that, and she said, but negative for the present. Positive exposure to COVID, yeah.
Do you think that makes a difference if you have antibodies, Dr. Rodriguez?
Yeah. So what their studies have shown that if you have a documented previous infection with antibodies and you get at least 1 dose of the Pfizer or Moderna vaccine,
Mm-hmm.
that immunity is better than 2 doses alone of Pfizer or Moderna for someone who hasn't had COVID. So it's the natural immunity you got from the COVID infection plus a little boost from the vaccine is better than if the immunity is better than if you had never received been infected with COVID and just the vaccine.
You might recommend just getting 1 dose then.
Well, yeah, that's what some of the that's what some of the studies have shown by measuring basically different people's immune responses after doing the 1 dose. The CDC still suggests 2 doses for everyone. It was more, I think, a public health measure. It's easier for people just to get 1 dose of the vaccine because of the 3-week follow-up. Sometimes people don't return, and so then the CDC classifies them as not fully vaccinated, even though the evidence might suggest that immunologically they are. And so it kind of depends on what Dr. Johnson, your local oncologist, or even your primary care provider or your naturopath would suggest. I think the CDC's position is still everyone should get 2 doses of vaccine when able. But I think from a practical standpoint, your mother already infected with coronavirus plus 1 dose of the vaccine would be pretty effective.
Yeah. Yeah.
Okay, good. Okay, well, thank you so much, everyone, for answering my questions. I've noted it all down here in the medical record. And so I'm going to leave the visit now. Dr. Johnson's with the patient right now, but we'll hopefully be able to return shortly and speak with everyone and discuss next steps and the road trip.
Okay.
Okay,
And-
so nice to meet everyone.
Yep, nice to meet you. Thank you.
Okay. Thank you.